Hi, this is Skylar Bond with Excellence Chiropractic. I'm putting together a quick video here for a friend and patient of mine with adhesive capsulitis or frozen shoulder. This will help anybody who's in that stage. He's in the stage 2 subacute, so we're getting a little bit more aggressive. Okay, so I'm just going to put together about your 5 movements that we're doing right now to remind you. We're starting off with Codman's arm circles. You remember this one's pretty simple. You have a really relaxed shoulder, and you're going to swing a weight. Ideally, this will be strapped to your arm, so you're totally relaxed. You're going to work this multiple directions. I'm trying not to use my shoulder to do this, trying to get all this motion happening from my hips. Okay, so strapping that weight to your hand is very useful for that. Now you've been working with that for a little bit, so it's starting to get a little bit easy, a little bit boring, a little bit dull. Let's work into some more ranges of motion. So I have this band here. What you're going to work on is getting traction and pulling out away. Your elbow likes to stay bent when you do this. I want you to avoid that. You're also going to be facing toward the wall and then going through. Finally, you're going to pull across your shoulder. Again, your elbow's going to try to bend. Don't let it bend. Try to have a relaxed hand. You're going to feel it all the way across the backside. I'm going to have you do that for 30 seconds and you change your motion. Go through that for 3 rounds. All right. So the other elements, after you've done a little bit of stretching out like that, you're going to do that inchworm stretch out. So your shoulder, if you have adhesive capsulitis, is a bit frozen to this range of motion. This is a way that you can use some of your body weight in order to increase that range of motion. So you can do this from your feet or from your knees, where you're just working that overhead range of motion. Now if you work that several times, 3 to 5 times, pushing into resistance but not into pain. After you get that opened up as well, I'm going to have you do a couple stretches to open up this direction. You can do one that's pretty familiar here. We talk about it all the time. Coming across the body into extension. Or you can do that more with a modified camel or against the wall. I think right now we're having you do the scorpion version. All right. After that, I'm going to have you get into just an armbar positioning move where what's most important is that you pull your shoulder down, come across, and make sure your hand doesn't stay open like this. You're going to see your nail beds. Right there. Okay. You can hear there's a smoothie being made over here in our cafe, so I'm going to have to speak a little louder. The last thing I'm going to do is I'm going to show you how to stretch out that trapeze so it gets really tight. You said you have a barbell at home, so use that barbell at home. Lean into the weight, pull down on it, lean away from it. Repeat 3 to 5 times. It's going to scrape up your neck a little bit, but it's going to make it move a lot better. And that's what matters. Okay, you guys need some random anatomy of the day. So, adhesive capsulitis, what is it? Basically, the ligament on the underside of this joint is your inferior axillary fold. It works like an accordion that contracts and expands as I do this. Now, for whatever reason, maybe an auto-inflammatory reason, previous injury to the labrum, what have you, what's happened in this presentation is someone sprayed some glue on that accordion when it was still down in this position, so it's very restricted coming back up.